Hello everyone. Today we will be discussing about the analgesics. It is a topic from the pharmacology. Analgesics are the drugs which relieve pain. So there are several type of analgesics but which are important for the Inbde exams are limited. We will be discussing all of them. First of all, there is Nsaids. Nsaids are known as non-steroidal anti-inflammatory drugs. The Nsaids consists of several drugs. Firstly, aspirin, ibuprofen, naproxen, ketorolac, Voltaren. All these are Nsaids. Has some more drugs as well, but those are not generally used in abundance. So we can say that they are very selective drugs and is not mostly asked in the questions. Now, what is the usage of NSAIDs? NSAIDs actually does analgesic action, which is pain relieving action, but along with it, it also provide antipyretic, that is decrease of fever, then anti-inflammatory, that is decrease of swelling, then inhibit the platelet aggregation, sorry, not formation, aggregation. The platelet aggregation causes the formation of clots, and because of this NSAIDs, many people can say that many people can experience that they have increased bleeding time for those who are taking NSAIDs for a very long period of time. And then aspirin is the standard drug which comes in NSAID, which can be seen as the main drug, and others are slightly variations of this drug. The aspirin is acetyl salicylic acid. It can also be termed as ASA. Sometimes it is named ASA or acetyl salicylic acid in some questions. So we have to remember that aspirin is acetyl salicylic acid. The mechanism of action is towards the COX-1 and COX-2 blocker, and it is an irreversible blocker, so no drug can reverse the action of aspirin until it warns off. Then it has several negative effects as well, as most of the drugs have several side effects. The negative effects of aspirin is, if we take aspirin for a very long time, then it can cause GIT effects, upset stomach, sometimes ulcer formation, and which can cause GIT bleeding as well. Several times it is seen that people taking aspirin for a very long time have experienced tinnitus, which is ringing sound in the ear, then nausea, vomiting, metabolic acidosis, delirium, salicylism, and hyperventilation. Now comes the second drug in this line is ibuprofen. The maximum dose of ibuprofen recommended per day is 3.2 gram, and it is also same as aspirin, COX-1 and 2 blocker, and it is also irreversible. Sorry, this one is reversible. So the difference between the aspirin and the ibuprofen is aspirin is irreversible whereas this ibuprofen can be reversed by any other drug. So mostly people prefer to give ibuprofen instead of aspirin because of this advantage. Now this also has a negative effect. So the negative effect of ibuprofen is mostly occurring on kidney. The another drug is naproxen, ketorolac, and Voltaren. Voltaren is also known as diclofenac and is also used in a situation where pain control is very important, necessary, and quick action is required. Ketorolac is also does the same thing, that the onset of action is very fast, and it also has a period of 4 to 6 hours where it suppresses the pain. So mostly in dental practices, when the patient has severe pain, so the action which can be taken by the dentist could be giving them dissolvable tablet of ketorol, which is also known as KDT or ketorol DT. This tablet will start suppressing the pain, and patient get relieved as soon as he takes the medicine, and by this the dentist can easily manage the situation of severe pain for few hours. Apart from this, there is Celecoxib. It is also has brand name Celebrex. This is a selective COX-2 blocker and specifically effect on the sites which is having COX-2 related blocker were required. And along with this Celecoxib, there is another drug which is similar to this, which is known as meloxicam. This has brand name known as Mobic, and this is similar to Celecoxib, that is COX-2 inhibitor, and mostly this is used for the bone related pain. So it is mostly given in the patient with arthritis. So meloxicam is a drug which is COX-2 inhibitor, and this is given to the patients with arthritis. Now this was about Nsaids, and we will move towards the another drug which is Acetaminophen. It is not an Nsaid, and the important thing which is related to this drug is that it does not affect the platelet aggregation. So it does not increase the bleeding time, hence patients do not have a risk of excessive bleeding and increased bleeding time. So this is good for this has this advantage over aspirin. This drug also affects the central nervous system, and the negative side of this drug is it can be hepatotoxic if taken in very high doses. The maximum dose for this drug is 4 grams per day. More than that will be hepatotoxic for the patient and can cause the several type of liver related problems. It has an important indication that it can be used in a pediatric patient who is having a viral fever. Actually, in a pediatric patient who is having a viral fever, they do not actually can take any kind of aspirin related medicines, because it will turn into a condition known as Rees syndrome. Now the Rees syndrome will be can be quite fatal also if it gets disturbed and It cannot be managed properly, but it can be avoided by substituting the aspirin related medicine with acetaminophen. So this acetaminophen is a very famous choice in doctors for the pediatric patient who are having a viral fever and requires a painkiller or an analgesic.